Reverse puberty, second spring, the change. They're all terms used to describe menopause, an inevitable part of a woman's life. For years, menopause was rarely, if ever, discussed, and studies published by the National Institutes of Health show it continues to be understudied and undertreated in the medical community. Menopause is when a woman goes at least 12 months without a period. Signs can include hot flashes, weight gain, and mood swings. Another study published by the NIH shows 25% of women experience symptoms so severe, their daily working lives are affected. But help is available to ease these unsettling symptoms.
The most common treatment is hormone replacement therapy, or HRT, but some medical experts believe traditional HRT isn't the only answer. Reporter Tracy Cornett examines the use of hormone pellet therapy using primarily testosterone and why some doctors are hesitant to recommend it.
Running used to be Jamie Newmeyer's passion.
I felt like I could have ran a marathon most days.
Until the symptoms of menopause started running over her.
I definitely hit that point when I didn't feel like getting out of bed in the mornings. Like I forgot what I was talking about in mid-sentence.
Jamie's extreme fatigue and brain fog motivated her search for help.
Do you have any questions?
I guess, is it gonna hurt?
Ultimately, getting a controversial treatment called hormone pellet therapy.
Restoring a natural physiological state with a molecule that their body is very familiar with. You doing okay?
Jennifer Heinrich is the physician's assistant who administers Jamie's treatment.
And from here on out, it's just going to feel a little bit like pushing and pulling and tugging.
Women have their hormone levels tested and can opt for a custom pellet based on their result.
You feel a little pinch.
Roughly the size of a grain of rice, it's implanted into the hip with a tiny incision, releasing a steady dose of hormone lasting 4 to 6 months. But the therapy is not FDA approved.
Is women's safety at risk here?
It can be.
OBGYN and Vanderbilt professor Dr. William Lee prescribes estrogen, progesterone, and even testosterone cream for some patients. But he does not believe in pellets, which can't be removed or even adjusted once implanted.
We have no safety data, long-term safety data, or even short-term safety data on what's the impact.
The other debate surrounding the pellets involves what's in them. More women are getting primarily testosterone in their treatments.
When our testosterone is optimal, we have better energy, better motivation on your game. It obviously helps with libido.
Testosterone is approved by the FDA for men. Why isn't it approved for women?
Historically, most medical studies involve men.
That's not okay for Jamie or Jennifer.
What advice do you have for women who feel ignored and dismissed by their doctors?
To find another clinician who will listen to their concerns, because there are people out there who know a lot about this and can help.
Help Jamie hopes will get her health and happiness back on track.
Now we're living a quarter or a third of our lives after menopause. And, some of us want to dance to the finish line, not just limp to the finish line.
The doctor we spoke with says some women should avoid any form of hormone replacement therapy altogether. Those with a history of undiagnosed vaginal bleeding, a history of blood clots, or a history of liver disease, uterine cancer, or breast cancer. And another important note here, hormone pellet therapy can cost between $300 and $600 for a single pellet, and it is not typically covered by insurance. In Nashville, I'm Tracy Cornett.